Welcome everyone to another session of the Rainbow 50 Plus Health Talk. Today is going to be about health in a slightly different way because we started our discussions around muscle groups a couple of weeks back, and today is just about completing the rest of the muscle groups which we need to cover in order to have a broader understanding of the major groups in of the major muscle groups in our body. My name is Dee Abimbola, and I am your trainer today, and so I welcome us all to this workshop. We want to look at the aims of the training, but before we look at the aims, we want to discuss about the wider aims of our group, Rainbow 50 Plus. What do we stand for? Why do we come here every Tuesday, 52 weeks of the year or almost? What do we want to change within us? What are we aiming at? I want some discussions here, if you don't mind. Anyone? Yes, Statiti.
We come here so that we age well.
Absolutely, brilliant. Thank you very much. Our overall aim is so that we live well and age well. We must always keep that in mind. It's not just enough to live well. Most people live well, but as they are aging, then things start to go wrong. Yes, the aging body will obviously demand a little bit more because the older our bodies are getting, there will be wear and tear. And one of the essentials of aging is what we want to talk about today. We don't want our muscles to age to the point that they are not functioning well. We want our muscles to be functioning well. And as you know, for Rainbow 50 Plus, it's not just about the physical body. We are also concerned about our mental well-being. We talk about anxiety, we talk about depression, how to reduce them, even if we cannot completely take them out. And we talk about healthy eating, what we should be eating for the older body, what the older body can cope with. We talk about vegetables, we talk about proteins, we talk about limited carbohydrates because we don't want too much sugar in our system because the older body cannot handle sugar the way a younger body will probably handle them. Also, we talk about different illnesses or conditions which aging tends to exacerbate, such as dementia, diabetes, different types of conditions. Those are the issues we concern ourselves with. And everything is all about living well and aging well. We all want to live long, don't we want to live long? Yes. We want to live long, but in living long, we want to live healthy. Yes. We want to be able to lift our bodies. We want to be able to move around. We want to limit the number of aches and pains that we have. We want our bodies to be happy. We want our minds to be happy. We want our families to be happy. So these are the kind of things we discuss. But today, we want to talk about the major muscle groups in the body. And the specific aims of this training is so that we target exercises to meet the requirements of those specific areas of our body. We are doing our exercises with understanding. When we just finished our exercise session not too long ago, so we've been jumping up and down. Before we started the jumping one, we were doing the chair-based yoga, because yoga is about stretching every muscle, stretching and stretching. If somebody asked you, which one would you prefer? Chair-based yoga or the one that makes you jump up and down? You probably go, oh, I'd rather have the seated one. But when we had it and we stretched to some point, we knew that it could also be challenging because the muscles are not very happy when you stretch them, but your body will thank you for it. So we want to continue to stretch our muscles so that they are healthy. So when we exercise, we want to know what areas of the bodies of the muscles we are targeting. So as we go along, I'm going to need our help. Because we've been doing exercises for God knows how many months. So I will need people who will come forward to help us to demonstrate what muscle we are talking about. As I mentioned, a particular muscle, then you will do a particular routine, exercise routine, to show us how we exercise that particular muscle. Is that clear? Yeah. So please think about it, how you are going to help me. I need a lot of help today. So I just want us to look at the second aim. The second aim is so that we're able to explain when things go wrong. When you are feeling some pain around here, or let me start from the very beginning, around here. What muscle will you say to your healthcare provider around the muscles around this area? What do we call them? The muscles around the shoulder. Deltoids. So that is by way of revision. We have done all of these things, but I don't want us to forget. We have done all these things. So they are the muscles that control the shoulder. Oh, I can't lift my finger and my shoulder. I'm not able to lift it. I'm not able to go like this. It's so painful. And you want to explain to your doctor or to your nurse or to your healthcare assistant. So you just go straight, oh, I have pain around my deltoids. Deltoids, go on, show me. Are you sure? And you're pointing at the right area where the pains are. So we've done this one. I'll just skip through. So we talked about the deltoids, and we talked about what they help us to do, and so on and so forth. And then we also talk about the biceps. Where can we find the biceps? Okay, can somebody lift their weight and show us quickly how to exercise the bicep? Well done, well done. I found two of us. Excellent. When you lift the weight and you go like this, when you see, thank you very much. You see the boxers, their biceps are so huge, because they need to develop them so that they give that heavy punch. For us, we don't need to box anyone, but these exercises are very, very helpful to us to lift stuff. We want to lift the grandchildren, we want to lift our shopping bags. When we're cooking, we need to lift. When we're doing different things, you need the bicep muscles, okay? And then we have the triceps. We have the triceps muscles. Where are they located? I'm trying to find a picture. I probably don't. Okay, they are located at the back of our upper arm. That's where they are located. That's the triceps. So it's very important for us to remember all these things. And the fourth one we talked about are the pectoral muscles. Where are the pectoral muscles located? Can somebody show us where the pectoral muscles are located? Yes. Oh, we have some excellent students in this room. Please demonstrate it. That's yes. Pectoral muscles are located somewhere, where you have the ribs. Where we have the ribs, that's where the pectoral muscles are located. So they are also very important in helping us to lift things or to stretch properly the spread across that region. So when you want to do your car seat belt, and you need to do anything at the back, or you want to put something in the back pocket and all. So it is a very important group of muscles. Okay, I was looking for the picture here. I have them now. So they are spread all over those places. It's important for us to exercise them. Okay? As well, we have the abdominal muscles, which we talked about as well. They're all there. And as well, number 6, we talked about the obliques. They are also located at the side of the abdomen. At the side of the abdomen. So, and they help to support the spine. They help to keep the spine healthy and to support them, so we're able to twist very well. We don't get stiff when the obliques are working well. And you know, many older people are stiff. It's so hard for them to look back. So we don't want to age in that way. And it's only when we exercise them. Okay? Obliques, obliques, obliques. Then we have the trapezius muscle, or just the traps. They are a very large group of muscles, and they are located in the upper and middle section of the back. So they help us, you know, you remember what one exercise did we do today that stretched this group of muscles very well? Did we do that? Very good. When we did that, you remember? And then when you turn your head to one side, in the chair-based yoga, you turned your head, you held it for a bit, you turned it back, and then you drop it, and then you drop it in the center. So all of these are exercising the trap muscles. They help us to turn our heads, to have a good use of our head, so we're not, oh, this neck, I don't know what's going on. It's probably that muscle. I won't be able to say for sure. It's only a doctor who will be able to diagnose you appropriately. Also, we already discussed about the lats. Those are the large muscle at the sides of the back, at the side of the back section below those ones. So they are very, very important, and they help us, you know, you remember that exercise we do when you sort of, you could have weight or no weight, and you are bending, you are going like this, you are keeping the shoulder blades, you are squeezing the shoulder blades behind. So those muscle groups are also important. Then you have the erectospinal muscles. Those are located below the lats, and they have a lot to do with keeping our bodies straight, our upper bodies straight, so we are not bent over. We notice that many people in aging, they tend to bend over, but being conscious of it also helps. Let us, you know, be aware of it, that I don't want to bend. We discussed a lot around this the other time. So they help us to keep straight. Those are the exercises that help us to maintain them. When we could also go flat and then keep the shoulder blades, squeeze them together. So we went as far as number 9. Now we want to start our discussions today on the glutes. So this group of muscles are located all over much of the buttocks. Can somebody please just touch their own buttocks? Just yours, not another person's. Yeah, thank you. So those are the glutes. They spread all over, and nowadays I think it's now in fashion. I see a number of ladies really growing their glutes. People can actually grow it. They do exercises day and night
No, they put something there, mommy.
Oh, they put something there. but people actually grow it when they go on exercising it. The muscles keep growing and growing and growing, and not to the extent of what we see in fashion. Those ones are enhanced, but people can actually grow it for a bit if they want to. So why are they important? They help to maintain balance when we walk and when we run. Also, they help us to move backwards. It's a challenge as people are aging, moving backwards, like even stepping backwards or moving sideways. You remember those exercises, we're coming there. So, what exercises what is the best exercise to strengthen the glutes? Yes, walking is good.
Mm-hmm. Lifting the leg up.
Lifting the legs up. Yeah. When we were going one step after the other. But there is one that is so good. I'll show us in a bit. Our lunges.
Okay.
Our lunges. We've done it in different ways here. Sometimes we go 2 steps forward, two steps backward, 2 steps forward, 2 steps backward. You remember? Those are lunges. And then you remember, we go like that. But when you're doing your lunges, you want to keep your head up, not looking down and going like this. It's not the same. When you're facing forward and you're holding your 2 hands like this, and then the hips are going down. The hips are going down as low as possible. Many parts of Africa where people stood to use the low, even much older people, they have no problems doing lunges because that's how they use the low. But for me, it's so difficult to go really down, and stay there. Have I?
Yeah.
I don't think so. Because I've seen much older people, back in Africa who really go down and stay there and get up without any problem because they do it every time. So our lunges are so important, and they keep apart from the glutes, they keep our knees really strong. So we're able to go down and come up. Many of us, if we need to do exercises that take us to the floor now, we need help getting up. So the glutes are so important. Let's keep working on them, those exercises, even if we need to do them more, to do the repetitions more when we get home. Let's continue to work on them. Those glutes are very, very important. They help us as well to keep our upper bodies strong and fit. So that's all we need to talk about. Any other exercises? We've talked about lunges. We've talked about our knee raise, to keep our glutes strong. Any other exercises for glutes? Let's try and recall from what we've done today. There were about 2 more where the lady was talking about the glutes. This keeps the glutes strong. I leave it with us as homework. I will send sitting across the chair. Thank you. Even when we crossed, yes, the one with the chair-based yoga. And then we stretched the leg. Many of us were screaming as we were doing it.
Yes.
And then even the one where we crossed our legs, where we sat and crossed the leg and tilted forward a little bit, is stretching much of the glutes. That's
Squatting.
yes. Squatting is very important. Thank you. So let's keep this in mind. Okay. We want to talk about hamstrings. Hamstrings are located at the upper back of the legs and thighs. They really spread out just below the glutes those muscles spread out and you can actually see them. So you don't want to hurt them at all, because they are so vital to moving, because they help us to bend the knees, they help to propel our bodies forward as you go in, you walk in, so you are engaging them in walking, not just on the same spot, but in the movement. And they help us to run, and they help us to jump. When we jump or we do a little bit of, you are landing on, you are depending on those muscles. So it's so important for us to keep them working well. So what exercises do we need to keep our hamstrings going on beautifully? Jumping jacks, yeah? It's so funny, we have not been doing any jumping, and I don't think jumping jacks are good for older people. You know what I mean by jumping jacks? Yeah, because jumping jacks, you land heavily, you land on your feet. Yeah, jumping jack is when you go like this, we don't want that. But you remember what we ended with today. No?
Oh, stretch it.
When you go, no, I think it's it's the back one that is straight.
Yes.
So when you keep that one really stretch, and can we just try and do it? Yes, so that you get it once and for all. Okay. Rest your hand on the back leg, the one at the back. Dig into your heel. Dig into your heel. Rest on your heel, or for the back leg. For the back leg. No, the back leg should be straight, Elder James. Sorry. The one at the back should be the straight one. The one at the back. The one at the back should be straight.
No,
keep it straight. Bend the front one. Bend the front one. Keep that one straight. Let it face forward, please. When you dig into the heel, you will feel that muscle.
I will report you to
Do you feel it?
Yes.
Do you feel it?
Yes, we feel
Fantastic. You are doing the right thing when you feel it.
Yes.
When you don't feel it, you are probably not doing the right thing. So it's not a painful thing. It's just you can feel the stretch. You can feel. We do it every time. We do it every time. That's the hamstring. And when the hamstring is hurt, when people have an accident or they hurt it, that's when they go like this, or they need what's it called? Crutches to walk. But when we continue to exercise this group of muscles, they will not get hurt so easily, because they will be resilient, they will be strong, they will be, they'll be like battle ready. So let's get every muscle in our body ready for any stress at all. So whether we are walking or we need to move a little bit faster, you are in the airport, you need to catch your plane, and you just need to walk a little bit faster so your body is ready. Also some more exercises. I don't recall we have ever done this once. We have not done this one. We have not done this once. Not today, Dr. Johnson. Not today. But I remember I was encouraging the men to, you remember when she was kicking the leg, and she was raising it really up, and the men were not really raising up their legs, whereas the women were really kicking hard, and they are working their hamstrings so well. So that's about the hamstring. And then the next one we're all so familiar with is the calves. The calves, they are located at the lower back of the legs. And I'm going to ask us to demonstrate some of the exercises we've done. think all of us should just remember straight away. When we get behind the chair, when we get behind your chair, everyone please get behind your chair. Now stand on your toes. No, I'm only asking you, you are doing the advanced level. Let's stand on your toes. Raise your height. Raise your height. Don't bend forward. Just raise it. Okay, let's go down. Again. Keep it there. Keep it there. Keep it there. And we go back. Can you take your hand off the back of the chair? Is it possible? Is that advanced? Can we go back? So that way we are strengthening. Thank you very much. Thank you very much. Take your seat. That way we are strengthening the calf muscles. And it's so important for us to strengthen the calf muscles. When we were young and ignorant, I used to think, oh no, ladies should not have we call it yam. But now we know that it's fitness. When you have a lady who is fit, they'll probably have a bit of calf muscles, not bulging out too much, but it's good to have a bit of calf muscle. That shows you are fit, you are exercising very well. So they are involved, we get them involved in climbing stairs. We really need our calf muscles to climb stairs or to go on an incline where we're trying to go, we're walking on the road and the road goes a little bit like this, a little bit of a slope, and we need to go like this. So we are engaging the calf muscles, and you cannot rule it out. You can't rule it out that you will never need to go on an incline when you are doing your shopping or when you are out and about. So we also get them involved when we need to jump or sprint. I know we don't do much of jumping or sprinting, but never say never. So those are what we use them for. Involved in lifting your heels up when you walk so you don't drag your feet. Have you noticed that older people tend to drag their feet when they walk? Yeah. So it's so important for us to be aware so that we are not dragging our feet to climb stairs, to jump or sprint. So those are our calf muscles. These are other types of exercises which we could do to strengthen the calf muscles. We could. Sorry? Some of which we have done today. Thank you. Some of which we have done today. You remember when we kept going like this, and she even varied it. All of those are very good for the calf. So those are the calf muscles and the exercises that go with them. So we have as well the quads. The quads. They are located in the upper front of the leg or thigh. So when you have them, can you feel your quads, please? Can you feel the muscles there? When we were doing the chair-based yoga, I felt my quads so seriously today. I don't know if you felt it. You remember when the lady was making our legs go like scissors. Can we try that again? Seated. Stretch the legs out properly and now try to get them to go. Where are you feeling the pull? Yes. That's how to exercise the quad muscles. So thank you. So the signal I got was that my quads are rusty. They are rusty. I need to exercise them more. Also, there is this other exercise we used to do. We have not done it, I don't know, maybe we did it last week. The one where we sit and then stand up.
Yes. Yes.
Okay, can we do that, please? Not holding anything, just standing up. So you are engaging your quad muscles to stand up. It's helping you, it's propelling you forward. So those are very, very good exercises that we need. Thank you very much. People are really strong and motivated. So those are the quad muscles. They help us to move effortlessly, especially from sitting to standing position, which we find ourselves in most of the time. At home, you are sitting, you need to get something from the kitchen, you need to get something from the wherever, you need to stand up and you need to engage those muscles. And
the bus.
in the bus, you get to your location, you need to stand up and get up and get off the bus and so on. As well, these muscles help to stabilize the knee joint. The knee joint. So when they are working well, we have fewer issues with our knee joints. So they also help to strengthen the legs. They are involved in walking, in squatting, as we said earlier on, in jumping, and in running. So we need to keep them healthy all the time. So it helps us to go effortlessly from sitting to standing, and to keep our knees healthy, to straighten the legs, and to be able to walk and jump with little or no issues at all. Yeah, there is also another quad exercise that is being recommended here, which we do it not in this way. In fact, we have done it today. You remember when we hold our chair and you go like this. I'm always finding it a little bit tough. You always put your leg on the chair. And you go like this. Do we remember?
Yes.
Okay, can we do it, please? And we hold it for a bit.
Maria watching.
Mary has no problem. Tell me where you are feeling it. If you try to straighten up, which I am really struggling with, you will feel it here. The muscles here will be exercised. The muscles here. So at least we've already, discussed 3 ways of exercising the quads, either that or sitting and getting up, and the third one. So we have a variety. If one doesn't work for you, you can try out the second one. So that's the quad. It's a very, very major muscle in the body. All the muscles are important. You don't want to injure any one of them. And this is why we need to work them up very slowly. You don't want to do all the exercises you need for a month in one day. Please don't do it. When you overwork your muscles, it causes more harm than good. So it's good for us to just do the exercises for a few minutes, maximum of 30 minutes, and then rest them. When we are not used to, or when we're just starting out exercising, it's good to exercise for 2 days. Allow yourself 2 days of rest. Let the muscles rest and recover. And then go on to do it again and take a break. And in time, the muscles have memory. They remember. So as long as you're doing them bit by bit, once your body gets used to a particular routine, change to another routine. And that was the discussion we were having earlier on when we were doing our chair-based yoga, that we did, Marie chose that particular exercise because we need to climb higher. We were already getting comfortable with the ones we were doing. Otherwise, our muscles will no longer improve. So we need to stretch them a little bit more and get them stronger. Well, we have finally come to the end of this workshop. We've discussed 13 major muscle groups in the body. At this point, before I thank us, do we have any questions or any contributions at all?
Are we going to do it again and again?
You mean this workshop?
Yeah.
We will probably,
be once a
it will probably come up again, maybe
Once every 2
next
months?
year.
Okay.
But on top of this, we are going to have a pop quiz.
Okay.
We're going to have a pop quiz.
Okay, I'm ready.
Does that sound interesting?
Yes.
Marie will probably draw some,
Yeah,
we'll need to fill out where each muscle is. Maybe she will draw the picture of a human being. I don't know how she will do it, but it will be up to us to identify which muscle is which muscle. Is that fair enough?
Yes.
Okay. Yes.
I know it's a bit of a long lecture and stuff like that, but can we have it on our page? Is it possible?
Yeah, why not?
Please.
Why not? Why not? Do we promise to go over there?
Yes.
If we don't go over there, we will score 0 in Marie's quiz. So we'll put it there, hopefully, and it's so easy to score 100% once you go over there. So we have pop quiz, maybe 1 or 2. One to locate where they are, the second one to identify what we use them for and the exercises. So I don't know how Marie will go, but let's expect them. But for God's sake, don't let us run away from Rainbow 50 Plus. If we don't like it, we won't do it. Should we do it? We should do it.
Yes.
We all agree.
Yes.
Okay. So we'll put it there and give us at least 2 weeks to go over it, to revise. And then the test will be simple. Sorry, I saw your hand.
I was going to say that, sorry, go on, Mama.
Okay. My question goes like this. At this age, my observations, if I sat down for a long time, if I get up, I'll be very weak. If I sat down for a long time, if I get up, problem.
I believe it has a lot to do with aging. It has a lot to do with aging. So what we all can do, what you can do is to keep working at your mobility. What I mean by mobility is try not to sit down for too long. After an hour, get up, go into the kitchen, even if you have nothing doing in the kitchen. Go into the kitchen, or in my home, because from the living room to the kitchen is a little bit straightforward. It's the old school kind of, so it's just a stretch, a long stretch. So I just go, I count back and forth, I walk back and forth like 40 times. If I have enough time, I do it 100 stretch. Because the weather is not really good to go out, but rather than doing nothing, just go in the home, even in the living room, just go back and forth. After 1 hour, climb upstairs if it's not too difficult.
Or not to up to 1 hour, 30 minutes.
After every 30 minutes. After 30 minutes, you will be amazed how much it helps. Because when I forget and I sit down because sometimes I just find myself falling asleep, and the next minute, 2 hours later, I'm wide awake, and that's still the television watching me. So I just continue watching the television for another 2 hours, and altogether it's 4 hours. So if I now stand up, it is pain. Everything is stiff. So I never try to do that. And Dr. Johnson will remind me, don't forget, get up, take your little walk. Otherwise, don't get up and start saying, ooh, ah. Just do your little walk, go up and down, and it helps a lot. But don't feel too bad about it. To be honest, we will all get old. We will all get old. We can only do our best.
Why I agree that we will all get old? I still believe very strongly that we should make these little efforts.
Yes.
Because don't let us just say, it is the gene thing. It's old age that is troubling me. No, old age doesn't mean that we cannot still be fit. We can still be fit.
Absolutely.
Oh, people at old age, you can still be fit. Because whatever we like to say, if one can follow the habit of not sitting down sedentarily on the same spot. For example, tomorrow we won't be in Rainbow. Day after we won't be in Rainbow. So if you sit down and you are just sending children makeup for you,
Culture has affected.
thank you, ma. It's better if you need a cup of tea, get up by yourself. Use it as opportunity to move.
Absolutely.
And move up and down before the water will boil.
Yes, I will take myself to toilet.
Practicalizing it.
And when the water boils, then you make your tea and you come back to your seat again. And then after you sit for a few, like 30 minutes, get up again and pick the cup to go and put it in the kitchen. But as Sister Dasola said, because we are cultural, if you have grandchildren with you, we tell you, say, you come and take this cup.
In fairness, people are now used to us when we go back to Africa.
Yeah.
I mean, when we just started going back, when we settled here, and people will say, why would you do that by yourself? Why are you sweeping all by yourself? Why are you cooking all by yourself? We want to do it. I really want to do it. Let me continue to do it for as long as I'm able to do it. 20 years on, say, but you still want to do it? I say, yes, because I'm still able to do it. So let me do it. Whatever I'm able to do, let me do it. If I'm not able to do it anymore, I will ask for your help. And it keeps us going. And they say, oh, is that why you people who live abroad, you never get old? I said, is that right? Said, but you are still so fit. I said, well, it's just a matter of choice. I choose to keep fit. So whatever you are able to do, please do it on your own. People may be offended. Oh, you are making us nervous. When people come in, they say, oh, why are we allowing you to do all of these things? I say, explain to them that I have made that choice to do it by myself. It has nothing to do with you. Mr. Dasola.
Just a few years ago, I don't know if anybody will remember, here in the UK, some children, they started on the WhatsApp to make it funny. They said the way you will know a Nigerian mother, you are downstairs, and she's downstairs and you are upstairs. And then she will call you, Jide, come down, Larry, come down. And then the moment they come down, they will say, pick that thing for me. Say, why can't you are down there? Why do you have to come all the way from upstairs? I think so that really affected so many of us there that people started to do it themselves rather than calling the children from upstairs. I'm down, we are downstairs, is right in front. So it was a joke around the time, and then I think it woke some of us Nigerians up.
Thank you. I think I saw that joke. I even saw it even this year. Okay. So to be honest, it's good for us to get up and do things for ourselves. Mommy, I think, does that help a little bit?
I'm okay.
Okay. Whatever you can do, take your little walks inside. You don't really need to do all these hectic exercises we do here. Even if it's just walking up and down, getting up, sitting down, getting up, sitting down, getting up.
Upstairs.
Climb the stairs, go upstairs, slowly, deliberately leave your phone there, walk slowly there, bring it down, take it up, and so on and so forth. Well, at this point, I want to say a big thank you to every one of us. Thank you for patiently